master MRI. Forget memorizing sequences. If you understand only TR, T and TI, you will understand almost every MRI image. Today we discuss about TR, T and TI. Let's start. TR इसका फुल फॉर्म होता है रिपीटेशन टाइम और टाइम ऑफ रिपीटेशन. TR is the time interval between two consecutive RF excitation pulses applied to the same slice. इसका यूनिट होता है मिली सेकेंड और MS. TR primarily controls longitudinal relaxation or T-on relaxation. Short TR means incomplete recovery of longitudinal magnetization, which leads to strong T-on whitening. Long TR means more complete recovery, which leads to reduced T-on contrast, increased PD or T2 whitening depending on TE. इसका टिपिकल वैल्यूज होता है टी ऑन वेटेड सीक्वेंस के लिए 300 ms टू 700 ms एंड फॉर पीडी और टी टू वेटेड सीक्वेंस के लिए 2000 ms टू 6000 ms. नेक्स्ट हम बात करेंगे टी के बारे में. टी का फुल फॉर्म होता है इको टाइम. टी इज़ द टाइम फ्रॉम द सेंटर ऑफ द RF एक्साइटेशन पल्स टू द सेंटर ऑफ इको सिग्नल. इसका यूनिट होता है मिली सेकेंड और MS. टी डिटरमाइंस द अमाउंट ऑफ ट्रांसफर्स और T2 डीके बिफोर सिग्नल एक्विजिशन. शॉर्ट टी मीन्स मिनिमल T2 डीके विच लीड्स टू लेस T2 whitening. लॉन्ग टी मीन्स ग्रेटर T2 डीके विच लीड्स टू स्ट्रॉन्ग T2 कॉन्ट्रास्ट. इसका टिपिकल वैल्यू होता है T2 के लिए 80 to 120 ms, T1 और PD के लिए 10 to 30 ms. नेक्स्ट हम बात करेंगे TI के बारे में. इसका फुल फॉर्म होता है इन्वर्सन टाइम. TI इज़ द टाइम बिटवीन 180 डिग्री इन्वर्सन पल्स एंड द 90 डिग्री एक्साइटेशन पल्स इन इन्वर्सन रिकवरी सीक्वेंसेस. इसका भी यूनिट होता है मिली सेकेंड और MS. TI इज सिलेक्टेड टू null द सिग्नल फ्रॉम स्पेसिफिक टिश्यू when its longitudinal magnetization crosses 0. इसका एग्जाम्पल होता है स्टीर, फ्लेयर, PSIR एक्सेट्रा. स्टीर और शॉर्ट टाइम इन्वर्सन रिकवरी के लिए TI वैल्यू होता है 150 to 180 ms. ये फैट सप्रेशन के लिए यूज़ होता है. और फ्लेयर के लिए TI वैल्यू होता है 2000 to 2500 ms. ये CSS सप्रेशन के लिए यूज़ होता है. So TR controls T1 contrast, TE control T2 contrast and inversion time or TI suppresses a specific tissue. Remember TR equal to recovery TE equal to decay TI equal to nulling. Now we discuss about some important one-liners on TR, T and TI. You can revise this topic by practicing these 100 one-liners. Let's start. TR or repetition time is measured from the center of 190 degree RF pulse to center of next 90 degree RF pulse. T or echo time is measured from center of excitation pulse to the center of echo. TI or inversion time is measured from 180 degree inversion pulse to the 90 degree excitation pulse. Image contrast in MRI is primarily determined by TR, T and TI and flip angle. Short TR is equal to 300 to 700 ms produces T-on images, or T-on is equal to 300 to 700 ms produces T-on whitening. Long TR means 2000 to 6000 ms minimizes T-on whitening. Short T 10 to 30 ms minimizes transverse relaxation. Long T 80 to 120 ms maximizes T2 contrast. PD weighted imaging uses TR greater than 2000 ms and T less than 30 ms. T1 weighted spin echo typically uses TR 400 to 700 ms, T 10 to 20 ms. T2 weighted spin echo sequences typically uses TR 3000 to 6000 ms, T 80 to 120 ms. FSE or fast spin echo T2 sequences often uses ETL between 8 and 32. ETL means echo train length. Increasing TR increases scan time almost linearly. Reducing TR shortens acquisition but decreases SNR. SNR means signal to noise ratio. Increasing T decreases SNR due to greater T2 decay. Longer T accentuates susceptibility artifacts. Short T minimizes magnetic susceptibility artifact. TR determines longitudinal magnetization recovery MZ. T determines transverse magnetization decay MXY. Ti or inversion time determines the point of longitudinal magnetization nulling. Tissue signal becomes zero when MZ or net magnetization vector crosses the null point. Null point nearly equals to 0.69 into T1 relaxation time. Steer uses Ti approximately 140 to 180 ms at 1.5 Tesla. Steer Ti at 3 Tesla is approximately 220 to 260 ms. Flare Ti value is approximately 2000 to 2500 ms at 1.5 Tesla, to 2400 to 2800 ms at 3 Tesla. DIR or double inversion recovery uses two inversion pulses. DIR suppresses CSF and white matter simultaneously. PSIR improves contrast in myocardial imaging. This PSI sequence actually used in cardiac MRI. TI or inversion time selection depends on field strength. Higher field strength increases tissue's T1 relaxation time. Therefore, TI values increases at 3 Tesla. Fat T1 values nearly goes to 250 ms at 1.5 Tesla. For white matter, T1 value is equal to 600 to 800 millisecond. For gray matter, T1 value nearly goes to 900 to 1100 millisecond. For CSF, T1 value is 2500 to 4000 millisecond. Fat T2 value is 60 to 80 ms. For muscle, T2 value is 30 to 50 ms. CSF T2 exceeds 2000 ms. Long T makes CSF hyperintense. Long TI or inversion time in flare makes CSF hypointense. Steer suppresses all tissues with short T1. Steer should not be used after gadolinium. After gadolinium, we use T1 FS or T1 sequences. Fat saturation is preferred for post-contrast imaging. Steer is insensitive to magnetic field inhomogeneity. Chemical fat saturation fails in severe B0 inhomogeneity. TR affects SAR or specific absorption rate in fast spin echo imaging. GRE sequences can use TR below 20 ms. GRE TE may be as low as 2 to 5 millisecond. Balanced SSFP uses TR around 3 to 6 ms. Flash sequences use low flip angles with short TR. Spoiled GRE relies on T1 recovery. EPI can have TE around 30 to 100 ms. For diffusion imaging, usually uses TE 60 to 100 ms. Increasing TE improves bold sensitivity. Bold sequence is actually used in functional MRI. Functional MRI commonly uses TE around 30 ms at 3 Tesla. TE should approximate T2 star in bold imaging. T2 star is always shorter than true T2 value. Gradient echo lacks a 180 degree refocusing pulse. GRE images are more susceptible to field inhomogeneity. Spin echo removes most static field inhomogeneity. Echo spacing differ from TE. Effective TE is used in fast spin echo. Effective TE determines T2 contrast in FSC or fast spin echo sequences. TR is shared among slices in multi-slice imaging. Very long TR values reduces saturation effects. Partial saturation occurs with short TR. Ernst angle depends on TR and tissue T1. Ernst angle maximizes signal in GRE imaging. Flip angle and TR jointly determine GRE contrast. Short TR requires smaller flip angle. Long TR allows higher flip angles. Inversion recovery begins with 180-degree inversal pulses. Spin echo begins with 90-degree excitation pulse. Steer is excellent for marrow edema detection. Flare is highly sensitive for periventricular lesions. For multiple sclerosis plaques, best seen in flare sequence. Acute infarcts appear bright on flare after several hours. Flare is less sensitive during the hyperacute stage. TR has the greatest influence on total scan duration. TE contributes minimally to scan duration. TI or inversion time prolongs inversion recovery sequence time. Increasing matrix size does not alter TR. Increasing NEX or average increases acquisition time. Long TR improves SNR, long TE reduces SNR. TI affects lesions conspicuity in inversion recovery imaging. CSF suppression improves visualization of cortical lesions. Fat suppression improves lesions conspicuity in bone marrow. TR, TE and TI must be optimized together. MRI protocol optimization always starts with contrast requirements. T1 weighted images require short TR and short T. T2 weighted images require long TR and long T. PD weighted images require long TR and short T. STIR requires short TI value with long TR and long T. STIR is basically T2 base sequence but fat suppressed. So STIR requires short TI with long TR and long T. Flare requires long TI with long TR and long T. Tissue contrast depends on relaxation differences between tissues. Incorrect TI causes incomplete tissue nulling. Understanding TR, TE and TI essential for MRI protocol design. Golden formula for this is TR controls T1 value, TE controls T2, TI controls signal nulling, while flip angle controls GRE contrast.